Vital signs. Vital signs, often called cardinal signs, include body temperature, pulse, blood pressure, and respiration. More recently, oxygen saturation has also been considered essential. These indicators reflect the body's functional status and must be assessed with great care and accuracy. The results should be evaluated in the context of the patient's past and present health conditions and communicated clearly to healthcare providers. Need for vital sign measurement. Vital signs should be measured upon hospital admission, during the collection of baseline data, and according to written physician orders. Once stabilized, a patient's vital signs may be taken once daily. They should be reassessed whenever the patient's condition changes, or symptoms such as dizziness occur, before and after surgery or invasive procedures, and before and after transfusions. If any value is abnormal, reassessment is required at least every 4 hours. In cases of unstable conditions, such as during surgery, vital signs may need to be monitored every 5 to 15 minutes. Whenever there is a marked change from previous readings, values should be measured more than once to ensure accuracy. Normal adult ranges. Axillary temperature is 36 to 37 degrees Celsius, pulse rate is 60 to 100 beats per minute, respiration rate is 12 to 20 breaths per minute, and blood pressure is less than or equal to 140 over 90 millimeters of mercury. Body temperature. Temperature is regulated by the hypothalamus. Core temperature is most important and can be measured rectally, orally, axillary, esophageally, or tympanically. Rectal temperature is most reliable and usually slightly higher than oral readings. Oral temperature tends to be 0.3 to 0.5 degrees Celsius, lower than rectal, and is influenced by environmental factors. Esophageal readings closely reflect heart blood temperature, while tympanic readings are similar to hypothalamic temperature. The body maintains a core temperature of about 37 degrees Celsius, though peripheral tissues vary with environmental conditions. After menstruation, temperature remains low, then rises by about 0.5 degrees Celsius at ovulation and stays elevated until the next cycle. Children generally have higher and more variable temperatures than adults, and newborns or premature infants are particularly sensitive to environmental temperature changes. Advantages and limitations of temperature sites. Oral measurement is convenient but unsuitable for infants, unconscious patients, or those after oral surgery or on oxygen therapy. Rectal measurement is highly reliable but contraindicated in patients with rectal disease, rectal surgery, or cardiac conditions due to vagal stimulation. Axillary measurement is safe but less accurate and contraindicated after axillary surgery. Tympanic measurement is quick and reflects core temperature but may be inaccurate in the presence of earwax. Temporal artery measurement is also quick, safe, and reliable, even for infants. Factors influencing temperature. Age plays a role, as infants have immature thermoregulation and the elderly tend to have lower body temperatures. Circadian rhythm causes body temperature to be lowest around 4 a.m. and highest between 8 p.m. and midnight. Hormones also influence temperature. Progesterone raises basal body temperature during ovulation, and menopause causes fluctuations. Stress activates the sympathetic nervous system, increasing temperature. Exercise raises body heat, while environmental conditions can also directly alter body temperature. Types of thermometers. Clinical tools include mercury and glass thermometers, which are widely used but fragile. Electronic thermometers for oral or rectal use. Disposable chemical thermometers. Temperature-sensitive tapes for children and infrared thermometers for tympanic measurement. Pulse definition and normal range. The pulse is defined as the wave of blood produced by the contraction of the left ventricle, serving as an indicator of cardiovascular status. Cardiac output, CO, is calculated as stroke volume, SV, multiplied by heart rate, HR. In healthy adults, the normal pulse rate is 60 to 100 beats per minute. Peripheral pulse measurement. Peripheral pulses are assessed by palpation using the index and middle fingers, never the thumb. Both sides should be compared for symmetry. Common sites include the temporal artery, carotid artery, brachial artery, radial artery, most commonly used, femoral artery, popliteal artery, dorsalis pedis artery, and posterior tibial artery. Factors influencing pulse. Age is significant as infants have higher pulse rates, while elderly individuals usually have lower rates, often under 80 beats per minute. After puberty, men generally have lower pulse rates than women. Fever increases the pulse due to accelerated metabolism. Medications such as digitalis slow the pulse, while atropine and epinephrine increase it. Blood loss activates the sympathetic nervous system, raising the pulse. Exercise elevates heart rate, though trained athletes may show resting bradycardia. Stress, acute pain, and anxiety increase the pulse, while endocrine conditions such as hyperthyroidism also cause tachycardia. Sympathetic nervous activity increases heart rate and contractility, raising cardiac output, while parasympathetic stimulation decreases both, lowering cardiac output. Apical pulse and pulse deficit. The apical pulse is indicated for patients with cardiovascular, pulmonary, or renal disease, for infants and toddlers, and in obese or elderly patients where peripheral pulses are difficult to palpate. In adults, the apical pulse is auscultated at the 4th to 6th intercostal space, about 8 centimeters left of the sternum. Normally, apical and radial pulses are equal. When the apical rate exceeds the radial rate by more than 10 beats, it indicates a pulse deficit, often associated with cardiovascular disease, and must be reported immediately. Abnormal pulse patterns. Tachycardia is defined as a pulse faster than 100 beats per minute, while bradycardia is slower than 60 beats per minute. Arrhythmia refers to an irregular pulse rhythm. Intermittent pulse alternates between normal and irregular beats. Coupled pulse presents as 2 beats followed by a pause. Alternating pulse shows a regular rhythm but variable amplitude, often seen in hypertension or left ventricular failure. Premature beats are weaker contractions that occur earlier than expected. Sites of pulse measurement and clinical use. The temporal pulse is often used in children. The carotid pulse is useful in shock because it is easily accessible. The apical pulse allows auscultation of heart sounds and is preferred in infants and young children. The brachial pulse is checked to assess circulation in the arm and during blood pressure measurement. The radial pulse is most common for routine assessment of peripheral pulse characteristics. The ulnar pulse may be used to evaluate circulation in the hand, such as in the Allen test. The femoral pulse is also useful in shock and for assessing leg circulation. The popliteal pulse is checked for circulation below the knee and during lower limb blood pressure measurements. The posterior tibial and dorsalis pedis pulses are used to assess circulation in the feet. Definition of respiration. Respiration is the movement of air in and out of the lungs. Inspiration refers to the act of breathing in, while expiration refers to the act of breathing out. Respiratory control mechanism. Breathing is regulated primarily by the medulla in the brain. Chemoreceptors located in the carotid and arterial walls are highly sensitive to hypoxemia and especially responsive to changes in carbon dioxide (PCO2) levels, which strongly influence respiratory drive. Normal adult respiratory rate. The normal range for adults is 12 to 20 breaths per minute. During normal breathing, there should be no visible contraction of accessory muscles such as those of the shoulders, jaw, or ribs. Factors influencing respiration. Age is an important factor. Infants have a higher respiratory rate, while older adults show reduced lung capacity and shallower breathing. High fever increases respiratory rate. Stress and anxiety stimulate the sympathetic nervous system, causing both rate and depth to rise. Medications such as narcotic analgesics and anesthetics reduce respiratory rate, while stimulants such as cocaine increase it. Long-term smoking leads to structural changes in the airways, raising the respiratory rate. Exercise increases oxygen demand and thus respiratory rate. Environmental temperature also plays a role, with high heat accelerating breathing. Conversely, increased intracranial pressure can depress respiration and slow the rate. Oxygen saturation. Oxygen saturation, SaO2, refers to the percentage of hemoglobin in arterial blood that is bound with oxygen. The normal range is 95 to 100%. Values below 95% are considered abnormal. Oxygen saturation can be measured indirectly and non-invasively with a pulse oximeter. Respiratory assessment. Assessment of breathing includes observing the respiratory rate, depth, rhythm, and the quality of breath sounds. If breathing is regular, it may be measured for 30 seconds and multiplied by 2. If it is irregular, a full 1-minute count is required. The measurement should be performed unobtrusively so that the patient remains unaware, preventing voluntary changes in breathing pattern. Blood pressure. Blood pressure is the force of blood pushing against the walls of the arteries as the heart pumps. It is expressed as 2 numbers. The first, systolic pressure, is the pressure when the heart contracts and pushes blood out. The second, diastolic pressure, is the pressure when the heart relaxes and fills with blood. The difference between the two is called pulse pressure. For a healthy adult, the average is about 120/80 millimeters of mercury. When measured at the thigh, the systolic number is usually 10 to 40 points higher than in the arm, though the diastolic number stays about the same. How blood pressure works. Several factors influence blood pressure. If the heart pumps more strongly, the pressure rises. When the small blood vessels tighten and resist blood flow, pressure also goes up. A loss of blood or fluids, such as with bleeding or dehydration, lowers pressure. Thicker blood raises it. What affects blood pressure? Age naturally raises pressure since arteries become less elastic over time. Exercise temporarily raises it by increasing blood flow. Stress activates the sympathetic nervous system, tightening blood vessels and pushing the pressure higher. Race, weight, sex, and hormones also play roles. For example, men after puberty tend to have higher readings than women, but women often see pressure rise after menopause. Medications can lower or raise pressure depending on their effect. Blood pressure follows a daily rhythm, lower in the morning and higher in the evening. Illnesses such as kidney disease can raise it, while bleeding or anesthesia may lower it. Smoking causes vessels to constrict, raising blood pressure. Abnormal blood pressure. High blood pressure or hypertension means readings are consistently above 140/90. This is a major risk factor for heart disease and stroke. It may develop on its own or as a result of another condition. It needs long-term care, including lifestyle changes, medication, and regular checks. Low blood pressure or hypotension usually means below 90/60. It may result from blood loss or a weak heart. Symptoms include pale and cool skin, confusion, fast heart rate, and low urine output. A special type, called orthostatic hypotension, happens when someone stands up suddenly and feels weak or faints, because blood pools in the legs and the heart does not adjust quickly enough. Measuring blood pressure. It can be measured directly with a catheter inside an artery, or indirectly with a cuff and stethoscope, which is the common method. The cuff size must fit properly. The inflatable part should cover about 80% of the arm's circumference, with the width covering about 40%. For most adults, the cuff is 13 to 14 centimeters wide and about 24 centimeters long. Korotkov sounds. When listening with a stethoscope, the examiner hears several sounds called Korotkov sounds. The first clear tap is the systolic pressure. As the cuff pressure lowers, the sound changes, swishing, then louder, then muffled. When the sound disappears completely, that point is the diastolic pressure. Precautions and errors. Blood pressure should not be taken on an arm with an IV line, an arteriovenous fistula, a cast, severe pain, or after breast surgery. Errors can happen if the cuff is too wide or too narrow, if the environment is noisy, if the air is released too quickly or too slowly, or if the stethoscope is placed incorrectly. These mistakes can lead to readings that are either too low or too high.